can you talk about the side effects of this? Because before we get into nutrition and vitamins and supplements and that sort of thing, I want to talk about what to really be careful of and why maybe not take those medications until it's that last resort.
Yes, absolutely. It's interesting because I'm developing, as you know, and you heard from Sarah, I have a business background. And when I started to have very positive effect for myself, I was challenged. I was challenged by more of a male dominant class of people, of colleagues that were saying this is not feasible. So what I've done is an AI. I've created like a big fat data thing, just like men would do, to say, you know what, actually it does work and it's not bogus science, it's actually real science. And so in that AI and in that data that only serves the purpose of demigrating people worldwide, um, there's a number of things that we do see. And so, for example, I've had people that were having just constant dizziness, for example. They say, it's not that I'm in pain, I have migraine attack, but in between attacks, I'm constantly dizzy. And so I go to the doctor, I do MRI, etc., and the doctors kind of send me away saying, you're fine, it's in your head. Um, and that was a woman, for example, that was taking 30 years of antihistamines. And she forgot to mention it when we met because they were like vitamins for her. And so we decreased, we went from 8 out of 10 of dizziness to 1 out of 10. But at 1, we stayed for a while. And I'm like, you're really young. You should be on your feet by now. It's been 4 months. You should be done. Why are you not done? Can we talk? She said, "Oh, oopsies! I've taken 30 years of antihistamines." I'm like, can you stop that?" She's like, "I don't know if I can." And I think you can. Like, go back to your doctor and be followed. And she went to zero. She hasn't had a migraine in 2 years. Um, I've seen this as well on, for example, it's a really unusual case of people having to have antibiotics after sex, after intercourse. Otherwise, they have a UTI. And the antibiotics we currently can give fogginess, so different sensation through the vagus nerve. So think of the vagus nerve as this massive tree that has the foliage in your brain and the roots that surround all of your organs. Well, if you make your biome really weak, and very mucousy, phlegmy, with a sort of more MCAS style biome with so much antibiotics, then your brain will pick up that signal and starts to have very foggy sensations. And so for her, we corrected the root cause, which was, okay, now when you're going to have sex, you're not going to have a UTI. Wow, how are you going to do that? We're just going to do it. And we did it. And that's how you get to a non-foggy, sustainably brain. Sometimes I've seen another one, which is quite unusual, is melatonin. I have lots of questions on melatonin. I think we're quite clear on what the synthetic hormone does, and that's fine. My bigger question, I think, for the scientific audience that I highly respect is, how does it exit the body? And does it exit the body? Or does it create chronic inflammation and constipation in your large intestine that creates dryness in your brain and therefore creates a lifetime of sort of fuzzy, dizzy migraine?
Mm.
So, yeah, so this is another one. A last one I'll mention are antidepressants, also a very big question mark. There was a brilliant documentary done by the BBC recently on this topic, and I have a lot of questions on that class of medication, so SSRI in particular, because they will form more causes of sort of lack of mental clarity.
Yeah.
Um, yeah. So
Well, and
yes, lots of sequences.
I've talked a lot about the fact that most people that are depressed or put on antidepressants are actually low thyroid. And without that thyroid working, you have fatigue in the brain and the body, you have unexplained weight gain, you have stress over the fact that you don't feel good, which then is only going to make your headache and your brain not work even more. But the antidepressants, the medications, any medication, any prescription drug is seen by your body as a poison and is going to back up your liver. And your liver is working so hard for circulation, for thyroid hormone conversion, to get the ATP to the brain and the body everywhere, and to filter out those extra toxins, the microplastics, heavy metals, and everything that we're talking about. And it's only making things worse, and it's causing leaky gut. Your gut brain axis is direct. Your gut affects your brain affects your gut. And if your gut is not producing serotonin and dopamine, then you're not going to feel good in the brain. If you have leaky gut, you're not absorbing the nutrients, even of the good food that you're eating, to actually get to your brain, to get to your tissues, your muscles, your hair, all of the things. And that leaky gut is going to cause inflammation throughout the body. What happens is you have these proteins or food particles that get into the bloodstream that aren't supposed to. The body has a huge, over exaggerated autoimmune inflammatory response. Inflammation in the body, but inflammation in the brain. And that's going to make things worse. So these medications, whatever they are, really only use them for the last resort. We've done podcasts on the fact that we've got superbugs that are resistant to antibiotics. And that's why you want to use natural antivirals, antibacterials, and that sort of thing, and boost the immune system.